in public session. And the next member of the committee is Deputy Paul McAuliffe, a 10 minutes deputy. Very welcome.
I want to thank the witnesses for my sins. I've been voting on the Planning and Development Bill next door, so I apologise if I'm asking questions which have already been asked, and I'll review the transcript either way anyway. 3 areas I want to talk about. First of all, I want to talk about the capital budget for disabilities. So obviously disability has been taken out of health and is now with your own department. Can you explain to us the process around decision making on national disability projects, capital projects, and how that works with the Department of Health and with the HSE? What new mechanisms are in place around that?
I might ask my colleague, Mr. O'Connell, just to explain the process on that.
We inherited lists of capital projects after the transfer last year, in March last year. And what we're doing at the moment is a few things with the HSE to reflect, I guess, some of the changes that are underway. Capital and disability side over previous years, number 1 would have been probably underspent and was never spent to the amount that was given. Number 2, very, very heavily focused on decongregation and less on some other areas of disability services. So what we're doing is there's a new senior dedicated lead person being appointed to lead out on disability capital in the HSE for the first time.
Do you know that person?
And that person, no, that process has to happen.
Okay.
But we've sanctioned that. And there will be a strategic plan developed, a multi-year plan during the course of this year going forward. In the meantime, we want to have a more strategic approach to disability capital this year, and Minister Rabbitte intends making an announcement probably in the next couple of months in relation to where the spend is going to begin to change and become broader in terms of the projects that will be supported to reflect the action plan for disability services, which was published by government at the end of last year, and to a degree as well the roadmap for children's services. So
the question is, will it mirror or would it be substantially different from the HSE capital plan process?
No, there are processes that we fit into, obviously, as part of the HSE. A big part of the transfer function
So there'll be priorities from your department, but they'll be delivered via the HSE capital plan programme?
Correct, and the processes and procedures that will be followed would be HSE general processes and procedures, correct.
You got my hopes up at the beginning saying it would be separate, and then they've been dashed by saying that because the HSE capital plan project is so slow, you know, and I suppose one of the benefits of taking disability out of the Department of Health was for the reason you just said, that, you know, it wasn't getting the priority that perhaps it should, and often capital projects were the poor relation to other capital projects. So I suppose it would be disappointing if that separation didn't provide the benefit by virtue of the delivery. In other words, you could now have a situation where the HSE don't feel it's part of core health, and yet they've got these projects from another department within their process system. Is there a check or a balance that you have to make sure that doesn't happen?
Well, I'll talk to you about the practical difference since the transfer, right? In 2023, we had an underspent, unfortunately, disability capital, but it was 3 times in 2023. It was 3 times the amount spent the previous year. So it was a three times jump between 2023 and 2022. There was still an underspent, but both ministers are very determined that there not be an underspend on disability capital. So in terms of delivery and in terms of using the available envelope, which is increasing around 11% a year in the next couple of years, we've already seen a benefit, a very significant benefit on disability capital since the transfer of function into DCD.
So my understanding is that a national service, or a service that has a national remit, still needs to be sponsored by the local CHO as part of the HSE capital programme. Is that correct?
Well, it's a top-down and a bottom-up. So we have strategic plans, obviously top-down, endorsed by government. I mentioned the action plan and the roadmap. But what exactly is happening on the ground? Where are the areas of need?
I'll give you an example. Last week in the Dáil service in my own area, Teach An Saol, they provide resources and support for acquired brain injuries. They've met with the Minister several times. They've met with HSE estates. And I suppose there's a real question around who's the decision maker, who is the champion of the project. It's a national service, so the benefit locally in the CHO is, you know, it's quite limited. But there's people from all over the country coming to their services in Santry. And I think it's a good example of the discussion we've just had is, who carries the project through the HSE capital system? Is it the local CHO? Is it the local CHO operations manager, or will it those national services? Will it be the department, or will it be somebody at national disabilities level in the HSE?
Well, there's several. Is the direct answer. The Minister Abbott in particular, is very directly engaged on capital projects. It's a real priority for her. Capital is now on the quarterly meeting between our ministers and the HSE board, for example, that take place. That's been added to the agenda at the ministerial request. But the projects do come up through CHOs, but there's a very clear sense of a change in direction in terms of what we're doing on disability capital, and that's why we'll have an interim strategic approach this year, and there'll be a fuller multi-year approach, because capital does take multi-years. I mean, you may say they're slow, but there's some reasons why.
But I could understand the reluctance of a chief operating officer in a local CHO with all of the demands they have in their area, and then they're being offered up a project that has a national remit, and they're kind of saying, look, that's not going to be a priority for me because I have all these other areas in my CHO. It does require at a national level a project like that being carried. Would you agree?
Yeah, I mean, I don't disagree without knowing the ins and outs of that specific proposal.
Well, perhaps I might write to you on it, and we can engage on it. And I know the
and community neuro rehab more broadly beyond just acquired brain injuries is something that, in fairness, the HSE are progressing. There's a strategy that is being progressed, and the Minister and the Department are very interested in seeing that rolled out.
Okay, excellent. Okay. So